I am Dr. Philip Ross, one of the chiropractic physicians over here at the World of Wellness, and welcome to Wellness Week 102. And today, for the next about half an hour, I'm going to be talking about one of the specialties I have, which is I'm TPI certified. And what TPI certified stands for is the Titleist Performance Institute. And so there was a group of guys that came together that were working with a lot of professional golfers, and it is basically an assessment screen that assesses anywhere from the professional golfer. John Rahm's one of the main guys that gets worked on by a TPI certified golf professional, all the way down to the weekend enthusiast. Their golf has gained a lot of popularity. It seems like the past couple years, and that's what I mean. I love doing the golf screens. It kind of breaks up the monotony of the day, just treating everybody in the clinic, and it's very fun to work on a golf enthusiast and them come back in after I screen them and give them a treatment, and then some corrective exercises and stretches to do before they're around. And when they come in, they're like, "Doc, I had it 10 yards on my drive," or my knee was bothering me when I was golfing, or my low back or my hip, and now I'm golfing pain free. And usually I only play 18 once a week, and now I can actually play 36 because I'm out of pain. So um, that is basically my goal. So I am not a golf professional. So I am not going to be helping you with your swing, so to speak. But where I come into play, TPI has basically three parts. So you have a medical, a fitness, and a golf pro. And so my job is basically to get your body moving correctly and efficiently. So when you go to your golf pro on to try and tweak your swing, that you're able to do that and you don't have any kind of physical limitability. So we're going to dive into it. So the first part, I'm going to kind of explain what the TPI, the Titleist Performance Institute, is, and then I'm going to go into basically what we do for the screen. So TPI studied, as I was saying earlier, thousands of golfers, whether it's young golfers, professionals, collegiate, and then just weekend enthusiasts. And basically, they collected a bunch of data on how people move and basically the most efficient way to swing a golf swing. And they kind of just extrapolated all this data, put it together, and then we had our TPI golf screen. So TPI's main philosophy is we want to educate people on basically the body swing connection. And where I come into play as a medical provider is to basically analyze the physical limitations and how that could basically impact or lead to injury when you were golfing. And so the philosophy, there is not a specific way to swing a golf club. So if we look at Fred Couples, he swings drastically different than a lot of other guys on the PGA. And we were talking about John Rahm earlier. His swing's a little bit more short and compact. And actually, because he had a congenital anomaly, he was actually born with a club foot. So he had to actually change his swing to kind of work around the club foot because basically if it was a cookie cutter approach, hey, this is how you swing, he was going to be unable to do that. And I think just a couple months ago, he was the world's number one. So the TPI screen involves a couple different assessments. So you're going to look at the swing mechanics. We're going to look at your biomechanics. So basically, the TPI screen goes literally all the way from your neck all the way down to your ankle, and you kind of just assess motion. Physical fitness level is definitely important. Your movement quality, current health, and your medical history. And why the TPI screen looks at all of those, and not just specifically how you swing a golf club, because if you have medical history of post stroke, right? Say you have right side symptoms like your arms not as strong, legs not as strong. We're going to kind of have to tailor your TPI screen and basically just give you different things you could do to kind of go around, what's going on in your body. Current health as well. So if I get patients coming in, my back hurts, and then I just feel like my legs are fatiguing relatively quickly when I'm getting to hole 12 or 13, and I feel like by hole 18, I just don't feel like I have any juice. That goes into the current health. For example, if you're suffering from congestive heart failure, high blood pressure, we have to get these things under control before we just start to treat the physical symptoms. Because if we don't treat the chemical imbalance in your biochemistry, you're still going to have the weakness in your legs if it is coming from something like that. So it's a very, very comprehensive, well-rounded exam, not just involving you swinging a golf club. So And the main philosophy is they don't believe in one way to swing a golf club. There's a ton of different swing styles. Again, if we look at Fred Couples, you look at Tiger, you look at Rory, DeChambeau, and then the one of my favorite ones to watch is Scotty Scheffler. If anybody's a golf nut like myself, if you just watch him off the drive, his feet do some crazy things, and it is totally not what you're supposed to do, but it works for him, and he's playing lights out. Especially he played lights out yesterday. So it's basically just looking for it's looking at the biomechanics of that individual golfing and basically finding the right swing style that is perfect for their body. And when we were talking about the medical history as well, we were talking about how it screens literally from your cervical spine, so your neck motion all the way down to your ankle mobility. And that's massive that we have a comprehensive health history, because if you had a cervical fusion, or if you had a fusion of your ankle, and you don't have the full range of motion that you're supposed to have, then you're going to have basically a false positive on that exam, like one of the 16 main mechanical movements of the golf swing. So we basically just have to have a comprehensive, basically health history before we even dive into it. So the plans. So when someone comes in the TPI, basically the TPI screen, it's the 16 biomechanical movements of a golf swing. So we got to check your cervical range of motion, thoracic, lumbar, your hip, knee, ankle, wrist, elbow, literally looking at every joint involved in the golf swing. And there's a variety of different plans. So some of the plans include fitness training. Like if you just kind of feel like you're losing steam throughout the round, we could definitely give you things to work on outside of the clinic just to kind of increase that. Treatment or physical therapy. So if we take you through the screen and you are significantly lacking thoracic range of motion, I'm a chiropractor, and I feel like that can definitely for a locked up mid back. Nutrition. We were talking about if you're suffering from any kind of like congestive heart failure, high blood pressure. We're going to talk about what you could do nutritionally through your diet, as well as supplementation and nutraceuticals, what you could take just so you could feel at your overall best, so you could get through the round pain free and improve some scores here. And then last is coaching of the biomechanics. Again, I am not a golf professional, but we could basically talk to you about, hey, your golf coach over at your country club wants you to do this. You cannot do this due to, you have an impingement in your shoulder. You're lacking a little bit of range of motion in your internal rotation of your hip. And we basically just see where you're efficient and see where you're deficient. And then where you are lacking range of motion, we're basically going to provide treatment. And then my goal is to give you corrective exercises and stretches that you could do at home, basically to improve the quality of your golf game. Before I keep going any further, results vary. So if you come and get screened, say you're shooting, in the mid 90s, after you get screened and after we give you some corrective exercises and some stretches and get you treated, that doesn't mean you're going to go out and shoot a 79. But what I'm trying to do is basically allow your body to basically perform to its full maximal potential. So whatever you want to do with the club, you're able to do. Okay, so two main things when we talk about the TPI screen: heavy on mobility and stability. So, mobility, the technical definition, combination normal joint range of motion and proper muscular flexibility. So, in this picture in the PowerPoint, for a right-handed golfer, you have to have left cervical rotation and right thoracic rotation, and then we kind of go a little bit further into your lumbar spine and your SI joints, and then you go into your hip, knee, ankle, and then we also take a look at the elbows, wrists, and your shoulder as well. So you have to be mobile, and again, that's why it's so vital that you come in and get screened, because I am a chiropractor, but I went for my background. I have a master's in sports rehabilitation, and I'm actually a certified chiropractic sports physician. So I'm looking at bodies all day, right? Anywhere from like 18 to 20 patients coming in a day. So I have a really good sense of just basically checking range of motion, and we use the tools with the TPI screen to see if you're deficient, and if you're not at your end range, like the amount of degrees you should be getting with your neck, with your mid back. And then we're going to treat you in the room, and then we're going to give you all the best gold standard stretches and exercises that you could work on at home, whether it's a couple times a week or every single day, just to get your maximal basically range of motion in your cervical spine and thoracic spine. And we'll kind of get into, if you aren't able to get all the mobility in your joints, how that could actually kind of lead to an injury down the road. Um, and then this is a pretty cool picture. So this is Dustin Johnson. Crazy how they got this pic. So this is him basically bouncing on a physio ball. And so when we talk about stability, the biggest thing with stability, in my opinion, is going to be from your core. So when I was in grad school in St. Louis, one of the chiropractors that actually taught us, he works with all the St. Louis Cardinals, specifically the pitchers. And pitching, very athletic movement. You have to basically sink your upper extremity to your lower extremity. So if we're talking about stability, if someone's unstable or they're lacking core stability, one of the first things that I do is we basically talk about different kinds of breathing. I know that sounds crazy, but we talk about diaphragmatic breathing because that's basically going to help increase your core stability and link up your upper extremity to your lower extremity more efficiently. So your golf swing doesn't kind of just look like all piece. It's going to look like a fluid motion. So one of the best ways that I teach people to do this at home is I usually have them laying on their back with their knees slightly bent, feet on the floor, and then you're going to put basically a hand on your chest and a hand on your belly. And you don't want any motion on the hand on your chest. You actually want to breathe through your diaphragm. Diaphragmatic breathing is absolutely massive with this, any kind of athlete because, again, it's going to help to sync up upper extremity to lower extremity. And diaphragmatic breathing actually goes off a property of something called DNS, stands for dynamic neuromuscular stability. And that actually goes off of like infants. So when you look at children, young children, infants growing up, you never see any labored breathing, chest breathing, shoulders rising, and they're never breathing through their chest. They're always breathing through their belly. And so that diaphragmatic breathing, again, is going to help you engage your core and then sync up your upper extremity to your lower extremity. So one of the easiest and the most efficient ways to increase core stability, in my opinion, is a dead bug. It looks how it sounds. If we can move this camera, I'll kind of show you. But basically, a dead bug is you're laying on your back, your arms are up, and your legs are up. And when I basically coach people how to do a dead bug to increase core stability, we actually just put them in the dead bug position and basically just work on the diaphragmatic breathing. So it's trying to get your body used to breathing through your diaphragm and not trying to be basically like a chest breather, so to speak. So that's one of the best ways that you can increase the core stability. I also love bird dogs. I talked about the dead bug. Pal off press is great, especially for golfers because it's rotational movement and you're basically doing an isometric contraction with a band while you're basically keeping your core stability. So it's basically like a rotational movement as well. And so that's just getting into how we have to get certain tissues that are supposed to be more mobile and certain joints that are supposed to be mobile. We're going to increase motion, and then what needs to be stable is we're going to give you different kind of exercises basically to increase the strength, just so you're not moving where you should not be moving. Low back is a big example. A lot of golfers have trouble with. I'll just go up to this picture here. So this is Will Zalatoris. This was at the BMW Championship. This was last year, I believe, and he ended up getting surgery just a couple weeks ago because I believe it was an L5S1 disc herniation. Very, very common in golfers. So to prevent this from happening to you, we basically have to just give you the correct exercises and stretches based on your body, just so you're not basically loading certain structures that you don't want to be loaded, especially a disc. So that's where the stability comes into play as well. And this is talking about basically the working at all the joints all the way from your neck down to your foot and what should be stable and what should be mobile. So we are always checking ankles is a big one. Your cervical spine, rotation of your neck's massive too, because if you don't have full rotation of your neck, when you go into your backswing, you won't be able to keep your head down and your head's going to pop up, and then you're going to have a loss of posture. You're going to early extend, and then you're going to tax certain structures that you do not want to tax in the golf swing, because over time, same repetitive motion, if you were taxing a lumbar disc, especially an L5S1, the last straw that broke the camel's back, you are going to have an injury down the road, and we want to prevent that. And how limitations in mobility can predict instability. So there's something called reciprocal inhibition. So the best example is your quadriceps, so the front of your leg and your thigh, and then your hamstring, the back of your thigh. if you have one that's too strong and it basically will kind of like override another muscle, so to speak, that's when you're going to have an injury occur. So one of the best example is when I get high school athletes or college athletes, hey, I pulled my hamstring. You basically do a couple muscle tests and you see that their hamstring is significantly weaker than their quadricep, their rec fem dominant. So then you have your pulled muscle. So we have to make sure everything's balanced properly, and that's what we do in the room. So we're going to take you through the screen, and then I'm basically going to check the strength of your muscles, and if you basically have any kind of reciprocal inhibition later down the road, that is basically going to lead to an injury or any kind of dysfunction in your golf swing. Synergistic dominance basically just means, like, for example, if we're going to do a chest press, you really want to isolate your pecs. But if your pecs are weak, then you'll sometimes get anterior delt and a couple other structures that you actually don't want to recruit, but they're getting recruited just due to a deficiency. And then the last one is the arthrokinetic inhibition. That's where I come in as a chiropractor. If you basically have a joint or any kind of osseous structure that is fixated, so it's not moving properly, it's going to tax the adjacent soft tissue a little bit more, and then you're going to be stretching that tissue too much, and then you're going to end up having pain or dysfunction. And the muscle imbalance we were talking about. So everything we do in society is basically forward flex, right? Whether you're driving, eating, typing on the computer, sitting on the couch watching TV, we are always just kind of shoulders rolled forward, and then you get that anterior head carriage, and then your head's going to go forward. And that is something that could lead to a muscle imbalance that could actually hurt you, like in a golf injury. And we'll get into the upper cross syndrome in a couple slides here. And then other things that really, really jack people up is the prolonged postural stress. So if you sit 40 to 50 hours a week for your job, standing for too long, repetitive movements over and over again, lack of movement and sedentary lifestyle, these are all different things that could cause a muscle imbalance. And that's one of the biggest things in golf is if you do have a muscle imbalance, you're not going to be able to have the maximum range of motion that you would like. And then you're going to early extend, you're going to lose posture throughout the golf swing, or you're going to slide or sway, and just different things that you don't want to do in your swing. Okay, so we're getting into basically like two main things, lower cross syndrome and upper cross syndrome. Me and Dr. Orbach see this all the time. So lower cross syndrome, again, from prolonged sitting, this is one of the main ways that you get it is you're going to get a weak abdominal, so weak core. Weak glute max, and then you're going to actually have tight thoracolumbar extensors. So those are the main stability muscles of your spine going up through your back, and then you have tight hip flexors. Just a side note here, everybody's heard of the psoas muscle. You're kind of like they refer to it as a hip flexor muscle as well. It actually attaches on your lumbar spine, so the bones in your low back, and then it attaches to the front of your hip. Everybody thinks of stretching the psoas, which you do want to stretch the psoas, but if you're going to stretch it, you got to train it and actually activate it as well. So what I like to do is I'll just basically show patients how to stretch their psoas. There's a lot of things you can look on YouTube. Some of them are great. Some of them are kind of but we'll basically show you how the correct way to stretch your psoas. And then we'll basically show you just like different little intrinsic movements that you could do to kind of engage that as well. Same with the weakness in your glute max, so kind of like your butt, and then your core. So I feel very well first on basically giving and coaching patients how to do the correct exercises at home to fix the lower cross syndrome. And then the next one is the upper cross syndrome. So people that are working from a computer, I call them desk jockeys. Phil's been doing it, I mean, what, 55 hours this week? So you're on my schedule, I think, at after work tomorrow, right? Yeah, I saw you. So he needs it because what Phil's essentially doing is he's sitting in, unfortunately, incorrect posture. So what happens is when you're sitting a while, you lose your posture, and then you end up looking like this. And so when you look like that, basically what happens is your pecs get tight. So when your pec gets tight, it's going to basically roll your shoulder forward, and then your head, you're going to get that anterior head carriage. So your head is going to kind of stoop forward there. And so you're basically going to have tight upper trap, tight pec, and then you're going to basically inhibit your deep neck flexors and your rhomboids and your serratus anterior. So what we do in the treatment room is we'll assess if you even have this. There's a lot of people that have this. This is a really easy fix. And I always try and tell patients, hey, look, there's only so much we could do in a treatment. So I'm going to do everything I can in the time allotted while you're in the room. However, I'm a huge advocate of home exercises, home stretches. So I usually tell patients, bring your phone in, right? And so when it's close to the end of your treatment, you're going to take a video of me doing all these different exercises and stretches I would like for you to do, just so you remember. Because a lot of times I'll give patients 5 or 6 things to do, and I'll see them in a week or two, and I'll be like, "Hey, how'd that go? Did you try anything at home? Oh, I totally forgot what you gave me." So I just recommend when you come in for a treatment, bring in your phone so you can basically take a video of me doing it, so you won't forget how to do that at home. So, but yeah, honestly, upper cross syndrome and lower cross syndrome. I see a ton of it, and it's relatively easy fix. If you are a creature of habit and basically are 100% all in and compliant, and then you do your homework as well. And so this reviews statistics from the thousands of screens they were talking about. So we were talking about losing their posture. And the main reason that you are going to lose posture in a golf swing is due to a lack of range of motion in basically your mobile joints. So for example, if you had a prior neck surgery, so if you had like a discectomy or a fusion in your neck, you're not going to have your full range of motion of your cervical spine. So we're going to have to try and change your swing, because if you try and have that heavy high backswing and you can't keep your head down, you're going to lose posture and then end up loading different structures. For example, like your L5S1, that disc, just because you can't keep your head down. So that's one of the main things. If you're lacking range of motion in your neck, you can't have a massive backswing. It's going to have to kind of be short and compact, kind of like John Rahm's, just so you don't lose your posture. Early extend. So essentially, early extend is, if you're sitting at home just listening to this, it's you're trying to get too much power or height on the ball, right? So when you're coming down to actually when you address the ball, go through your backswing, and you come to hit it, a lot of people will kind of pop up. And that's because they're either trying to basically pop the ball up and get a little bit more height, or they actually losing a little bit, or they don't have enough shoulder range of motion. So they're basically trying to like throw their hips and their shoulders down and kind of like stab at it. And obviously that's not going to be a good outcome from the golf ball. But you're going to tend to have an injury as well. Early cast or early release is basically you're just kind of dumping your wrists, because you're not getting your body around quick enough. So at the end, you kind of just throw your wrist with the club. Players over the top, that basically means that you're basically coming down and stabbing at it. So you might just have to adjust the ball. When you adjust the ball, you might have to move a little bit closer, a little bit further away. We'll talk about that. And then the reverse spine angle. That's a big red flag, because if you're having a reverse spine angle, that is absolutely loading lumbar disc in your low back, and that is definitely going to lead to an injury. Um, and so this is the Big 12. So S posture, C posture. So basically, when you address a ball, we're taking a look at basically your upper back and your lower back. And an S posture is think of Beyonce butt. So you're kind of just standing with your butt kind of poked out and a huge curve in your low back. And then a C posture is you're kind of hunched over it. So you kind of just it just looks like you're kind of hunched over the ball. And we basically can talk about how that could load structures that you don't want loaded. And then the background here too. So this is kind of like over the top, early extension, the sway. So when you go through your backswing, you don't want to sway back and then basically go forward to hit the ball. You want to stay compact, and you actually just want to do all rotation through your hips and through your mid back. So we're not swaying back when we try and go hit the ball. And these are the Big 12. So this is what we're kind of looking for, or not what you're looking for, basically what the golfer will kind of show throughout their swing. And then we're going to go over different corrective exercises and stretches to basically get away from that. So again, like, the TPI is very, very fun for me. Growing up, I was a soccer kid. I played soccer my whole life. I played in college. We actually went over and played in England, Ireland, Scotland, and Wales, which was really fun. Unfortunately, I was playing pickup when I was in grad school, and just for a short stint when I came back home. And all my buddies are all getting hurt. One of my buddies tore his ACL. Another one actually broke his arm. And I saw it right on the field, and I was like, well, I can't do that. So I've always been an athlete. I love competing. And so I golfed a little bit when I was younger, but I really started getting into golf a couple years ago. And the TPI screen is very, very fun for me, just because, again, I do love golf. Actually got to play for the first time over at Nevillewood last Thursday. Fantastic course, by the way. Tough. But I love people coming in and they're like, hey, I caught the bug. I love golf, and I'm having some pain in my elbow. I think I have what's called golfer's elbow. Is there anything you can do for it? Absolutely. See that all the time. Dependent on your golf game actually. So like golfer's elbow is called medial epicondylitis. It's on the inside. Tennis elbow is called lateral epicondylitis. It's on the outside. Believe it or not, depending on your golf game, some people actually come in with a lot more tennis elbow as opposed to golfer's elbow, and they're actually having pain on the outside of their elbow, and that's probably because well, we could get into that if you're one of those golfers when you come in. But I just love basically improving people's quality of life, making them more mobile, giving them the correct, based on their assessment, the correct exercises or stretches that they could do at home, and then definitely getting them adjusted in the clinic. And it makes my day when someone comes in and they're like, yeah, doc, I was telling you every time I was golfing, my back was hurting me, or my ankle, or like just walking up the hills, like I just didn't feel right, or when I was swinging, I just felt like my shoulder, every time I had impact with the ball, my shoulder hurt. I love screening people and basically giving them everything they need to do at home, treating them in the room, and then them coming in a couple weeks later and like, doc, I golfed 36 holes, this past week, and I had no pain. Like, I'm feeling great. I'm hitting the ball a little bit further just because I'm a little bit more mobile, and I could just do what I want with my golf club a little bit more efficiently. So the golf screens are very, very fun for me. So if anybody listening at home wants to come in and get the TPI screen, again, it's the 16 biomechanical movements in the golf swing, adjusting everywhere from your neck all the way down to your ankle and your foot. So if you want to get screened, when you call into the clinic, say I want to schedule an appointment with Dr. Ross for the Titliest Performance Institute screen, or you could just call it the TPI, just so we could put you in the schedule right. Just because it takes a little bit more time the first treatment, and then the other ones are going to be like a routine treatment. But that is very, very fun for me. And if anybody has any questions, I always say after my presentations, my lunch is from 1 to 2 every single day, except for today. But if anybody has any questions about getting TPI screened, please give us a call. They'll direct you back to my office and we could talk about it. I'm here to help. I'm basically here to improve your golf game, get you out of pain golfing, and basically prevent anything bad happening down the road. Again, if you're losing posture, if you're early extending, you are definitely going to have an injury down the road. So let's get in here, let's take a look, and let's prevent that from happening. So thanks, guys, for joining me for this first half an hour. And then I will be back with Phil in a different location. We're actually going to be in our recovery room, where I'm going to be talking about a couple of different modalities that we have back there. It's called a Normatec compression boot, infrared sauna, and then we also got vibration therapy. And I'll talk about what most of the athletes use those basically services for. But if you're not an athlete, basically what you could use the compression boots, infrared sauna, and the vibration plate for. So tune in at 1 p.m. and we'll see you guys.
Hey, real quick, Dr. Len says Dr. Phil is an ace playing golf player. Yeah, or is an ace playing golf. Scratch golfer, he says.
So I think when we went down for our PTE,
yeah.
So Dr. Len asked me, he was like, what do you shoot? And I was like, I shoot in the 90s. And I think he thought I was hustling him. Is what I thought. So Dr. Len, I guess you're listening. I guess we're going to have a work trip in Florida here soon.
Yeah, soon.
Because I would love to go back down, and I'll have to reach out to you because I just played, I played Nevillewood the other day, and the greens were tough. But nice talking to you, Dr. Len. I'm going to shoot you a text here in a second. And hopefully you're watching this weekend. Text me who you like this weekend and if you caught anything yesterday. So, all righty, guys.